The presence of COVID-19 in Saskatchewan may be trending downwards, but health officials and outside experts say it's not a reason to become complacent. At a briefing on Thursday, the province's chief medical health officer revealed new modeling that shows the trajectory of the COVID pandemic. Along with cases, hospitalizations and ICU admissions are down, but it's not all good news in Saskatchewan.
We are still at the highest in terms of ICU census per 100,000 in Canada and plateauing a bit, but we need to stay the course and let these numbers come down considerably so that non-COVID services can continue to resume and come back online to their full capacity.
Dr. Shahab says that in order to avoid a possible fifth wave of COVID and another spike in ICU patients, people need to reduce their social interactions as much as possible. Health measures such as masks are expected to last through the end of the year, but as Premier Scott Moe said earlier this week, gathering limits are not likely to be implemented. At least one expert says the drop in cases could be producing a false sense of safety.
When I look at the ICU numbers and I look at the continuing death numbers, those are the numbers that really stand out for me. I think we've been lulled into some complacency by decreasing new case numbers, but that's because our testing is quite low and test positivity is still quite high.
Saskatchewan is still recording deaths at a higher rate than any other province in Canada. Dr. Shahab and Dr. Kendall say it's important that people resist the urge to intermingle if some people aren't vaccinated. Getting tested early and often would help the province, but the modeling shows that's not happening. During a week earlier this month, 66% of COVID-19 admissions were sent to the ICU within 24 hours.
So people are showing up late with severe illness, and so important to stay home and get tested at the earliest sign of symptoms that may be COVID or maybe another respiratory illness.
With the province preparing to vaccinate children as soon as Health Canada approves doses for younger age groups, officials say it's important to get vaccinated. Alexander Kwan, CBC News, Regina.